Hello, welcome on France 24. We are here in São Paulo, Brazil, with the former Brazilian Health Minister, Luiz Henrique Mandetta. Hello, Mr. Minister.
Thank you for accepting our invitation, Minister. On April 15, you were dismissed by President Jair Bolsonaro at a time when you were at the forefront of the fight against Covid-19. It happened after weeks of disagreement. On what grounds were you dismissed?
At that time, the world was facing a new virus. This was an unknown disease that was deeply affecting healthcare systems. The main countries affected were in the West, with Italy, France and the UK becoming quickly overwhelmed. In Brazil, we were seeing these reports from more developed nations that were suffering so much. The Health Ministry therefore decided to implement social distancing measures to protect ourselves. These social distancing measures led to the economic issues that we've seen. This is what I like to call the second wave. You've got a first wave affecting public health and then the second affecting the economy. And the President clearly decided to be more concerned by the economic impact, to prioritize protecting the economy over public health. He created a spurious dilemma, as if these two things could be managed separately, when actually they go hand in hand. You had a health ministry that was putting people's health in front of the economy, but at the same time, he was pushing people to get back to work and downplaying the public health risk. There comes a point that as a health minister, either you agree with your president or you get dismissed. And this is exactly what he chose to do by appointing another minister who was only in the job for 28 days. He was also a doctor, and he also had a disagreement with the president. Today, the president has handed over the ministry to military personnel that just follow his orders without any concern for public health.
Only soldiers can accept Jair Bolsonaro's orders. To disagree with him is to be dismissed?
My team was drawn from the public health sector. We worked to protect life, and we had three core principles. The first was to protect people, secondly, protect our healthcare system, and thirdly, defending science as the basis for any decision made. But all of the experts were replaced by military personnel. To me, this can no longer be called a health ministry. It is a health ministry that is occupied by the military.
This process of militarization of the health ministry and new attempts to distort counting methods, does it constitute an anti-democratic course of action?
The question is not so much whether it's anti-democratic, it's anti-life. And that goes well beyond any democratic concerns, in my opinion. The question is, how can we, as a society, protect our values? The life of our people is our core value. Some people believe that this goes against protecting the economy, because our figures are no longer trusted, despite how trusted as a ministry Brazil's health ministry was in the past. We were a reference on the continent. People would look to us as an example of how to manage public health. That credibility is key for any debate domestically and internationally, and that is being lost through this behavior.
Initially, Brazil was ahead in the fight against the pandemic. State governors introduced social isolation measures earlier than some European countries. But today, Brazil is the second worst hit by COVID-19. What happened?
I think that there are a number of factors at play. Our country is heavily marked by social inequality. We have favelas without any sanitation, a historic lack of housing, overcrowding, densely populated neighborhoods, a history of infectious diseases. And we also have a strong informal economy. Many people work without a documented job, and it's very difficult to stop that. I think that this disease may show to the world how important it is that we reduce these inequalities. Balance affects everything. Globalization is shaking up the entire world, and if we continue with this kind of transit of goods and populations, then diseases will also globalize, especially the infectious ones. These inequalities between countries are not good, not for Brazil or for any other country.
One of President Jair Bolsonaro's main arguments is that the virus will hurt the economy more than the health of the country. This is an argument that keeps reoccurring and is taken up upon demonstrators who support the president. Can you make sense of this economic argument?
That's not so much the problem. You never emerge strong for an epidemic. It's never happened throughout history. You simply cannot do it. If we had been more cautious, our economic recovery would likely be much faster. And this is seen through the study of previous epidemics. What this actually shows is that his mind is already on the re-election in 2022. Presidential elections are always about jobs and about the economy. So what the president is trying to do is distance himself from the public health crisis, leaving the crisis to the mayors and the governors. So he's saying there will be economic losses, but he didn't want them, as if GDP was not a global issue. He's pretending to not know that after the crisis, countries will have to come together to find solutions. We're going to need to rethink the world. We're going to need to come up with an economic recovery plan and stop thinking about just ourselves. But Brazil has cut itself off from that process through its behavior. I think that that is a grave diplomatic error.
The use of the chloroquine is a worldwide debate, including at the World Health Organization. And here President Bolsonaro stands up as a great defender of this drug, which is being produced in laboratory right now. What do you think of this miracle cure?
I certainly don't think it's a miracle cure. When you're faced with a new disease, of course, people want to jump to an easy solution. The president didn't support this drug for health reasons. It was actually for political reasons. He's telling people to take the drug and to go back to work. This goes against the advice of the specialists and the doctors and has no scientific foundation. I had restricted its use to the severe cases because we knew there was cardiovascular risk involved. But the president wanted to allow people to take the drug at home with no medical follow-up. I didn't allow it, my successor didn't allow it, but the military people who are now in charge have allowed it. Faced with this pandemic, we need to respect science. We need to respect research timelines, discoveries, the mistakes and also the successes.
In your view, Jair Bolsonaro doesn't respect science?
I'd say that he chooses politics over science.
In June, the International Criminal Court in The Hague started to look into a complaint against the Brazilian president and his management of the coronavirus crisis in Brazil. Do you think he could be held responsible and face charges for minimizing the severity of the health crisis?
His management of the situation certainly raises some questions and has shocked people. The underplaying of the crisis from the beginning has shocked the world. because other countries put the crisis ahead of the economic consequences. He's out on a limb saying that he does not want to stop the economy, saying that that would damage the economy more than the public health damage from not doing it. He's the only leader in the world taking this line. Trump had to backtrack, Boris Johnson backtracked, the president of Mexico also backtracked. The president of Brazil is alone in keeping this unfortunate stance and disrespecting the victims.
How do you see the next few months?
I think that Brazil will continue along the same path as many other countries on the continent. These countries are facing spikes in the disease and then drops and then successive waves afterwards. I think that until the end of August or mid-September, we are going to see cities be more or less contaminated depending on the case. Unfortunately, we are going to move forward without a real health ministry, with policy being made without the concurrence of mayors and governors. The international community must be ready to learn the lessons to be learned from this crisis. I hope that we will see debate and that this helps us live together better in the future. Without disregarding the differences between countries, we can work towards better harmony, better balance, so that we will be better prepared for future epidemics.
Muito obrigada, Senhor Ministro. Merci à vous and thank you for following us on France 24. Stay tuned. Et sur le monde, restez sur France 24.